Today we're going to an 83-year-old who had a chief complaint of dizziness, bit of confusion, slight disorientated, and has since then fallen over. Her baseline vitals are blood pressure 140/65, heart rate 70, temperature 38.6, slightly high, respirate of 16, and a BGL of 6.2, which is normal. Because the patient states that she initially felt dizzy and confused prior to falling, we will assess the neurosystem for any signs that may have led to a medical fall, as well as assess for a traumatic brain injury. Patients over 65 years and over do have a high incidence of intracerebral hemorrhage following minor falls, so we will act quick to rule out a TBI. We'll also gain a prompt patient history. Has the patient had any history of neuro or medical conditions, any falls like this before? Are they taking any medications? We've also still got to be wary that concussion can still occur when someone has had a fall, even if they haven't lost consciousness. A couple differential diagnoses for this could be, it could be a stroke or a TIA, a mini stroke, could be a UTI, they often cause confusion in the elderly, could be dehydrated, or concussion from another fall another day maybe. On arrival at the scene, we will do a primary survey, just assess ABCs. We'll also be sure to conduct a secondary survey. Just because she's elderly and frail, we don't want to make sure that there's any sort of pain in the wrist. Hello, ambulance.
Hello,
Hi, I'm Megan. What's your name?
Mary.
And what's happened today?
Not too sure.
Not too sure. Do you know why you called us?
Yeah, I think I just had a little bit of a fall.
Yeah, it looks like you've had a bit of a fall. Do you remember falling over?
Yeah.
Yeah. And do you know if you hit your head or went unconscious at all in your fall?
No, I didn't really fall very hard.
Oh, that's good. I've assessed your GCS as 14 just because she seems a little bit more confused than normal. Mary, I just want to have a quick feel of your head just to rule out any injuries. Do you mind if I do this? Do you mind if I take your beanie off?
That's okay.
Awesome. Alright, you tell me if there's any pain, alright?
No.
All okay around there?
Yeah.
Okay, nothing around here?
No.
Lovely. Alright, I'm just going to have a quick feel in your neck as well.
Yeah.
Any pain up there in the back?
No.
Awesome. And no neck stiffness?
No.
Lovely. Well, that sounds good. We'll put your beanie back on for you because it's a bit of a cold house, isn't it?
Mhm.
Alright, now I just want to do a quick test. Can you please give me a big grin, show me all your teeth like this? Perfect. And can you please puff out your cheeks like this? Awesome. So in doing that, I'm just checking that there's no sort of facial droop or weakness and just making sure that all the facial nerves are okay. The next test I want to do, can you please give me both your arms? What I'm going to do is hold them out like this, turn them up like that. I'll get you to close your eyes, please. And now, when I let go, I need you to hold your arms up, please, okay? Alright. Awesome. You can put those down again, thanks. So in doing that, I'm just making sure there's no sort of unilateral weakness or arm deviation as it goes down or rotation of the hand. Now I want you to squeeze my hands as tight as you can, please. Perfect. And can you please push against me? Nice. And can you please pull me towards you? Awesome. Alright, all that looks pretty good. And finally, can you please say purple hippopotamus to me?
Purple hippopotamus.
Yes, perfect. Alright, this looks a bit uncomfortable, does it? I think we'll get you up and we'll get you seated on a chair. What do you think?
Okay.
Alright, do you have any pain in your legs or anywhere else?
No.
Okay, what we'll do is we'll get you to put your legs up and bend your knees. You can hold on to me if you want. Alright, lovely. Yeah, we'll get you up and we'll walk you over to the couch and get a bit comfier.
Okay.
How do you feel with your walking? Can you walk by yourself?
Yeah.
Cool. While she's just walking, I'm just assessing her gait, seeing that there's no sort of like drag with her leg, and that there's anything abnormal. Is that normally how you mobilise?
Yeah.
Awesome. Alright. I'm also just going to do some checks with your feet. Can you put them up a bit for me? Lovely. And can you just push against my hands? Nice, that's good. And can you pull back for me? Lovely. All good. Alright, I'm just going to do a few more tests. I'm just going to assess your eyes. Can you just look straight at me, please? Perfect. Alright, and this side, just look straight at me again. Cool, so pupils are equal and reactive. Can you hear me doing this in this ear for you?
Yeah.
Awesome. And same in this?
Yeah.
Nice. And can you move your head side to side for me? Perfect. And no pain around there?
No.
Not on your neck?
No.
Lovely. Now I'm just going to do a quick coordination test. So what I'm going to do is I'm going to put your finger on your nose. I'm going to move my finger around and get you to touch the tip of my finger.
Yep.
So can you put your finger on your nose for me, please? Awesome. And now can you touch that finger? Nice. Again. Thank you. And here. Awesome. And now do you want to swap hands? Right, now that finger. Thank you. Down here. And here. Perfect. And can you shrug your shoulders for me, please? Lovely. And can you stick your tongue out and move it around for me, please? Awesome. All that is looking good. So the ABCD2 score is a really good indicator of how likely the patient's going to have a stroke within the next 90 days. Mary's probably just going to score a 1 because she is over the age of 60, but she's not hypertensive or experiencing any slurring or speech weakness, any slurring of the speech or weakness in the bodies like arm deviation or leg dragging. She's also not diabetic. How long did your symptoms last, Mary, when you sort of felt dizzy and stuff? Has it been going on for a while?
No, it was only like a minute or two. It was very sudden.
Very sudden, and they're all gone now?
All gone.
Also, awesome. Also, just because the symptoms lasted less than 10 minutes as well, that means it's a 0. So a final ABC2 score is only 2. That's perfect. And do you take any medications at all?
No, but I'm fit as a fiddle.
That is lovely. You're looking pretty fit. And have you had any chest pain lately or problems around there?
No, nothing like that.
And no problems with your breathing?
No.
Awesome. Any coughs, cold and flus lately?
No.
Perfect. And finally, any problems with your bowel motions or going to the bathroom?
Not problems. It just hurts a little bit when I go toilet.
Ah, okay. And have you sort of had any blood in your urine at all?
No, I've just been needing to go all the time, and when I go, not much comes out.
Ah, okay. And have you had any infections lately or felt a bit sick?
I haven't felt that great recently in the last day or two, but don't know what it is.
Oh, that's all right. And no pain in the abdomen?
A little bit.
A little bit of pain?
Yeah.
And when you go wheeze, does it hurt at all? Is it painful to pee?
Yes.
Yes, okay. So what I think's happened today, Mary, because you've got a temperature of 38.6 and you've had symptoms of dizziness and confusion, which has resulted in you falling over, as well as it's been quite painful when you wee, I think you might have a urinary tract infection, which are quite common in the elderly. What I've just described, the symptoms are all red flags in the St. John's for UTIs, so I do strongly recommend that you come up to hospital with us and they'll be able to treat you for it there. The urinary symptoms that Mary has talked about are consistent with that of an infection, which will need antibiotic treatment. Despite Mary not testing positive for a stroke, caution should be taken as dizziness and weakness can result or have resulted in a fall. Because the symptoms so rapidly resolved, it could be possible that Mary's just suffered a TIA, so should be monitored in hospital, as it's quite unlikely that the symptoms would have resolved so rapidly if they were being caused by the infection without treatment.